There is no place for politics in my office, and there should not be a place for it in your doctor's office either. Unfortunately, this is no longer true. The partisan ideology of a small minority of lawmakers in Washington has been imposed on us all in the form of the recently passed so-called health care reform. The federal government has invaded my exam rooms, and bureaucrats are inserting themselves between me and the people I serve. Every patient should know about this. So I and thousands of doctors like me across the United States are posting a letter to you in our offices. We are letting you, our patients, know that very soon the treatment recommendations that we give may be dictated by the federal government. And this may well not be the best or most sound medical advice. In this letter to our patients, we point out that Section 1311 of the new health care legislation puts the U.S. Secretary of Health and Human Services and her appointees in charge of establishing the guidelines for care that your doctor must abide by, or face penalties and fines and possible imprisonment. In making doctors answerable to the bureaucracy, this bill effectively makes them government employees and means that you and your doctor are no longer in charge of your health care decisions. As you can see, this new law politicizes medicine and, in my opinion, destroys the sanctity of the doctor-patient relationship. It undermines the nature of the American healthcare system, the best healthcare system in the world. Our organization, Docs for Patient Care, is working to preserve this relationship so that doctors can continue to provide you with the highest level of care possible. This is what you deserve, not ration care or dictates from a government manual. This is your health care that we are dealing with. You don't want the government making these decisions for you. They don't know what is best for you and for your family. Only you and your doctor can determine that. Putting the government in charge of your health care could well be fatal. Government-run health care does not have a good track record. You can be certain that when you are facing a life or death situation, you do not want a federal bureaucracy that has the efficiency of the post office and the compassion of the IRS in charge. Unfortunately, this is all politics as usual, but this time there's a lot more at stake. In the face of voter anger, some candidates are now trying to make a cosmetic retreat, calling for minor modifications in Obamacare, or pretending that they are opposed to government-run medicine. Don't be fooled. Unless the politicians receive a strong message about this power grab, our healthcare system will never be fixed, and the doctor-patient relationship will be ruined forever. My exam room is nonpartisan. It always has been, and it always will be. However, I and thousands of doctors like me are asking you, our patients, to help us to protect everyone's health. You can do this by voting in November and sending a strong message to those responsible for this mess. They are trying to destroy the best medical system in the world. Tell them that you want to be alone with your doctor when you seek medical advice. Tell every congressman and senator that voted for this health care law that you do not accept their vision for American health care, and demonstrate it by giving them all an early retirement. Despite countless protests by doctors and overwhelming public opposition, Obamacare was signed into law. Unless something changes, it will be the closing chapter in the story of American medicine. Please join us in this fight and urge your doctors to get involved and advocate for you. Please go to d4pc.org to learn more. Thank you.